BNC, America's Black News Channel. Watch 15 minutes. Share with everyone. Finally, news that speaks to us.
Remember when it was tough to get tested for COVID, and that would be an understatement, many of you complaining about those test kits that you wanted to come in the mail? Well, in mid-January, as the cases peaked, 2.5 tests were being processed each and every day in the U.S., but now with Omicron subsiding, testing numbers have plummeted. But health experts are warning that testing is now more important than ever. Dr. Hiral Tipirneni is an emergency medicine physician, and she joins us this morning from Phoenix. Dr. Tipirneni, thanks for being with us. 2 months ago, the tests were scarce. People were complaining. Now they're in abundance, and the White House is saying order more. When it comes to testing the virus, the sooner someone knows that they have it, the better. Should we use the abundance of tests now to test ourselves on a regular basis?
Well, thank you for having me. And yes, you're exactly right that we should be using the abundance of tests. We got into trouble because we didn't have that abundance of tests, that supply that we needed when we got hit by the Omicron surge. And as a result, we were chasing our tail because it was the hospitalizations that shot up before we actually knew, hey, you know what? The actual number of cases and community transmission is much higher. So it's about basically having some idea of what is going on in the community. And the only way to know that is to test. Obviously there's regular standardized reasons for testing, right? If you have cold symptoms or other symptoms related to COVID, if you obviously a lot of people who are traveling, you need it to travel abroad or, just to get it cleared by the airline. Obviously schools and workplaces and other places like that, or if you've had contact with somebody who's tested positive or has COVID. But essentially what it gives us is some insight into what is happening in our communities. So we don't want to be blindsided and find out the surge by knowing that hospitalizations are going up. Let's know what's going on with cases and transmission in our community so we can be better prepared.
Dr. Tipirneni, this is confusing because we keep crossing Rubicons, and then it seems like the bar keeps moving. There are truckers that are circling the nation's capital even as we speak, and they're complaining about mask mandates. They left California for a 2,500-mile drive across the nation. They got here exactly at the time that the mask mandates were being dropped in, of all places, Washington, D.C., Maryland, and Virginia, and they're being dropped nationwide. Testing was one of those big things that said, now they want us to take a test, but we can't get the test. What exactly, if we take all the politics away, should we be doing as a populace to make sure that we protect ourselves against COVID moving forward?
That's a fantastic question. And, there are many things we should be doing. And what we should be doing first and foremost is remembering the lessons of this pandemic that we have learned thus far. We have learned a lot, and we have to be prepared for that next surge. It will happen. And if it's not another surge of COVID, it'll be a different virus, but there will be another pandemic. So let's think about what we've learned. What we've learned is that mass testing helps because we can anticipate surges. We can know where the cases are replicating at a higher rate. We can be more prepared. We know that masks work. So I happen to be one of those healthcare professionals that did not agree with the CDC's decision to just allow lifting of mask mandates across the board. I don't believe people are looking at that map and assessing whether their county is at high risk. We know that it was already hard to get people to wear masks in the first place. So I think that was early, and I think that is a little dangerous right now, especially for those people who are immunocompromised, especially for children under the age of 5, and all those folks who are more vulnerable to the disease, including our elderly population. We should be investing in things like better ventilation in our office buildings, in our schools, in all public gathering places. This is what we know. These are the things that help us mitigate the spread of the virus. Better ventilation, consistent testing, masks, and of course, the mainstay of all this is to make sure everybody, as many people as possible, get vaccinated. And that means fully vaccinated, the 2 shots and your booster. And that is our best tool against this virus.
Dr. Tipirneni, I know this is a little off topic, but a lot of people looked at the Asian countries and said, why are they still wearing masks? And we thought it was for air pollution. And then we found out it was because they were very worried about SARS-CoV-2. And they didn't stop wearing the mask. I hear an awful lot of people saying that they got used to wearing the mask, and even though COVID numbers are going down, they're afraid of other diseases. Do the masks protect us from other diseases as well? And is there a downside to continuing to wear a mask?
There is no downside, and you're absolutely right that they do protect us, and that's a lesson that a lot of those Asian countries have learned. And let's also be clear, because there's this random statement out there that wearing masks is somehow detrimental to our children's education and to their social development. Asian countries have had children wearing masks for years, and they are excelling academically, and there's no issue there. So I want to make sure we stay with the science and the data. Look, what we know is when everybody was wearing masks in the last 2 winters, we had a huge drop in cases of influenza. We had fewer, colds and flus all across this country. And it's just common sense. What we're doing is we're mitigating the spread of, respiratory droplets and those aerated particles. And we're, being more wise and mindful of staying home if we're sick, making sure that we keep some distance if we, have a little bit of a cold or cough. Those are all common sense public health measures that we should be implementing all year round across our country. When we mitigate the spread of things like influenza, think about that as an economic, point as well as a health, because we're also limiting the number of days where kids might miss school or grown-ups might miss work. We're also limiting how many people end up in the hospital. That helps us have the medical resources to address other illnesses. So it is a net positive, and there is really no data-proven downside to wearing masks.
Final question before I let you go. I know the answer to it, and I'm going to go la, 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 la when you answer it. Cases are down more than 90% since the peak of the pandemic. Are we finally starting to trend in the right direction, and is there light at the end of the tunnel? And before you say there may be another variant out there, I'm going to go la, 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 la.
Well, I don't want you to tune me out. Look, I am as hopeful as the next person. We have made a lot of progress, but we also know that we have been fooled before. So all I can say is we got to keep our guard up. We know the measures that work. We have to be vigilant. And what we should do is invest in long-term public health infrastructure to make sure, even if it's not another variant of COVID, that we are prepared for another pandemic down the road.
Wouldn't it be amazing if my political panels were just as guarded and measured as you are? Dr. Hiral Tipirneni joining us this morning from Phoenix. She is an emergency room physician, and I didn't have to go la, 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 la. Dr. Tipirneni, thanks for being with us.